Hi there, I'm Mabel Jong. Thanks so much for joining me. You're watching the World Healthcare Congress Interview Zone, and I'm so pleased to have Dr. Emad Rizk in the chair right now. And he is the president of McKesson Health Solutions. So great to see you every year.
It's wonderful to see you, Mabel. That's why I come.
Well, there certainly is a lot of talk about what's needed to get this reform really on track and to meet deadlines that are coming up. What do you see as the biggest challenge going forward for all of the players that are involved?
Well, it's a great question. I think actually it's just volume. It's the volume of change. I don't believe that it's just the regulations. It's also a lot of the changes in the whole healthcare dynamics and the way that the new reimbursement models are evolving, the new delivery system models like ACO and patient-centered medical home. Almost everything in healthcare is changing all at once. It's kind of like changing the tires on a car while it's still moving.
Well, we certainly are moving from a wholesale market to a more retail, consumer-oriented market. And do we have the technologies to really support all of the change?
Yeah, that's also a good question. I'm not sure that we're going to move completely to a retail. I think we're going to exist in both worlds of retail and wholesale for a while. Like everything, as you know, in healthcare, things don't change that quickly. Do we have the technology? Absolutely. The technology is there. The ability to be able to move data back and forth is there. I think we are very well positioned for a lot of the changes. I think, as I said before, it's the volume. Let me give you an example. So when you look at the new reimbursement models, if you're on a provider side, if you're a healthcare system, and you have a contract with many payers, and many payers are paying differently. One is paying bundled, one is paying episode, one is paying differently. How do you know which patient is coming in belongs to which plan? So there requires a new level of data. I think we've built the technology, Mabel, very deep and in a vertical way. What we now have to do is start to build the horizontal structure, the bridges across the verticals.
And who is going to be able to take charge with that? And if it's not ready, what's going to happen to all of the progress that has been made so far?
I think it's a partnership between both industry and the private sector and frankly the public sector. I think we're working together. We see meaningful use moving a lot of this going forward. We see a lot of the healthcare players and the vendor community also stepping up to create a common platform for communication. We at McKesson just launched an organization called Commonwealth, which is really bringing a lot of the organizations, the vendors out there, to bring the data into one place so we could start to have a single patient identifier, which is really critical moving forward on how we're going to be able to pay for care and actually render care. You still need to understand who that patient is.
Will it simplify also the delivery of the information, make it more, it will be more comprehensive, but it will be easier also to read and interpret?
Absolutely. I think right now each of us has probably multiple records. Everywhere we go in healthcare, there's 2 to 3 things occurring. Number one is we have identified data on each of us, but in different places across the entire healthcare network. None of the data actually comes together, so you can unite them and unify them. And we don't have a single patient identifier that brings everything in. So if you start to get rid of the duplication and the triplication, there's a very good chance that you will be able to move things in a more synergistic manner forward.
It sounds great, but how long will that all take?
Years. Everything takes years. I think it's steps. I believe that we've had that first wave of disruption, which is the automation of our medical record, the moving forward of the vertical automation and the adaptability and the adoption of the technology. I think the next step is beginning to tie those technologies together around the patient and around payment.
Talk a little bit about cloud computing and what role that will have in this new era of data sharing and data acquiring that we're going to be going through for the next several years.
Right, and excellent question. It's an area that I've been paying a lot of attention to this past year. So the past couple of years, it's been a double-edged sword. We have the private sector stepping up and helping providers and payers to kind of put together a lot of technology and adopt it. The problem is, if you go across the entire country, there are many types of systems. So many systems. Each of them have their own databases and their own data. And none of them really completely talk across the entire continuum. And I don't mean just the hospital and the physicians, but also the hospital, the physicians, the ambulatory centers, the continuum of care, and the payers. All of this has to be connected. And if you went and actually started to hard code these interfaces, it would be a 10-year effort. So the cloud computing really helps for everyone to kind of put their data up there. You have rules up in that cloud, and the rules actually identify the patients and basically can create a single patient record or begin to create rules on how that data needs to be seen. Frankly, I think that is the only way for us to move forward. I don't think it'll be possible to change the entire systems again.
And where is this message most needed? Certainly there are many segments of the healthcare sector. So who are you going to be telling this to, and who needs to execute it?
I think the message is comprehensive. I believe that it's both providers, payers, and government, and the vendor community, and the IT companies. I think all of them need to come together and create a collaborative. Moving forward, I do not see a path forward without collaboration.
Right. No, I think that companies, entities are scrambling to really get together to work. Otherwise, it's the survival of the fittest.
I agree, but I think it's for the better care of our patients and for healthcare. Just the economic impact of healthcare alone over the next 10 years, we are looking at Medicare potentially doubling, not potentially, but will double. And obviously we don't have the economic means to pay for everyone that's coming in, so we have to drive a lot through efficiency.
Yes.
So if we do not get this right, we are facing some pretty significant hurdles in the future. I think at McKesson, we really see that. We see that we do not want to do this alone. We want to do it in partnership with other companies. We want to do it in partnership with government and the public sector. We want to do it in partnership with providers and payers and physicians.
May I ask you, Dr. Rizk, you have a beautiful family, 3 young boys. What do you tell them you do when they ask you what your job is?
We didn't practice that before we started. I think they see me foremost as a doctor. Okay. They know me as a doctor. They see me take care of patients, in our lives, and I take care of patients in our church. So they really just see me as a doctor. They only know 2 things about me: that Dad is a doctor, and Dad works at McKesson. Those are the only 2.
They should also know that you're trying to help figure out how to make healthcare better.
We're all trying, not just me. Thank you so much.
Well, thank you, Dr. Rizk.
Thank you.
A pleasure.
Always a pleasure. Take care.
And I'm Emad Rizk. Thanks for watching.